There's a moment in every human birth when the baby has to rotate. Not because anyone tells it to, not because the mother is doing something wrong. The birth canal is shaped like a tube that twists, and the baby's skull, the largest thing trying to pass through it, has to line up with the widest part at each turn. If it doesn't, everything stops. No amount of pushing fixes it. For most of human history, that moment was not a medical emergency. It was the ordinary danger at the center of every family line. So how did ancient women give birth? Not just survive it, but do it often enough to keep the species going. The answer involves a badly designed pelvis, a baby that is born undercooked, and one of the oldest social technologies we have. Start with the body, because the body is the problem. Humans walk on two legs. That changed the pelvis from a simple birth canal into a kind of twisted bowl. Biologists call this the obstetrical dilemma. Walking upright rewarded a narrower pelvis, because a very wide pelvis makes the side-to-side motion of human walking even more expensive. At the same time, our ancestors' brains tripled in size. So natural selection was squeezing the birth canal while enlarging the cargo. The exact evolutionary pressures are still debated, but the mismatch is undeniable. Picture the human pelvis not as a simple ring, but as a shallow, curved basin. The top opening is widest from side to side. The bottom outlet is widest from front to back. In between, there's a kind of spiral. The baby's head enters sideways, then rotates roughly 90 degrees to fit through the middle, then extends under the pubic bone at the exit. The shoulders have to turn too. That's why human birth takes hours. A chimpanzee mother typically gives birth alone and quickly. A human mother has to work through a rotating, tight fit. And the baby doesn't just have a big head, it has shoulders. So the whole process is more like threading a flexible object through a curved, shifting passage than pushing something through a straight tube. Natural selection, as usual, did not solve the problem. It just made it survivable, barely. Here's the next strange compromise. If a human baby stayed in the womb long enough to be as mature as a chimpanzee newborn, its skull would never fit. So humans are born early. Biologically, you were born undercooked. A newborn can't hold up its head, can't cling, can't walk. That helplessness is the price of passing through the pelvis. It's why the first year of human life is basically a second gestation, outside the body. Then there's the thing that makes humans genuinely weird. A chimpanzee in labor usually goes off alone. She squats, gives birth, and cleans the baby herself. A human woman, in almost every known culture, does the opposite. She seeks out other people. The baby's rotation is too complex, the pain too intense, and the risk too high for birth to be a private event. We are the only primate that evolved to need a birth attendant, not as a luxury, as a survival strategy. Nobody knows exactly when this started. Fossilized pelvises from early hominins show the same tight fit. By the time Homo sapiens had a big brain and a narrow pelvis, birth was already a problem. So assistance probably predates agriculture, writing, and perhaps even modern language. It may be one of the oldest reasons humans became so intensely cooperative. So the first answer to how ancient women gave birth is usually not alone, and usually not on their backs. The modern movie image of a woman lying flat in a hospital bed is a recent invention. Ancient women mostly worked with gravity. In Mesopotamia, a woman might give birth while kneeling or squatting on specially made bricks. The bricks gave her something solid to brace against, and also carried ritual meaning. In ancient Egypt, women squatted or knelt on the floor, surrounded by midwives and female relatives. In Greece and Rome, a midwife might bring a birthing chair, a low stool with a crescent-shaped hole in the seat. The woman sat upright, gripped the arms, and pushed while the midwife knelt in front, ready to catch the baby. The word obstetrician comes from the Latin obstetrix, meaning a woman who stands before the mother. The medical specialty literally began as a midwife standing in front of a birthing chair. None of that involved lying down. Upright positions, squatting, kneeling, standing, let gravity do some of the work and can open the pelvic outlet a little. Ancient women didn't know the biomechanics, they just learned what worked. In many cultures, women held on to a rope suspended from a roof beam or a tree and pulled against it during contractions. Others leaned on other women who physically held them up during each push. Birth was active labor, not passive waiting. There's a temptation to imagine ancient women as tougher or more natural than women today. That's a myth. They had the same pain, the same hormones, the same pelvis. They just had fewer options. Before written history, we don't have birth records, but we can infer from societies that kept old traditions. The pattern is almost universal: upright positions, movement, and the presence of one or more experienced women. In many indigenous cultures in the Americas, women gave birth in a special lodge or hut, often with a midwife and female kin. In some African societies, birthing stools or kneeling positions were standard, with a midwife using oil and warm water. These practices were not primitive. They were adapted to the same biomechanical problem. And the midwife was not just there to catch. A skilled ancient midwife assessed the baby's position by touch. She used warm compresses and massage to relax the mother's muscles. She might break the waters if labor stalled. She knew that a full bladder could block labor and made sure the woman urinated. She knew how to cut and tie the cord. She knew not to pull on the cord too hard because that could turn the uterus inside out. Some Greek and Roman texts describe techniques for turning a breech baby before delivery, or delivering it feet first when there was no other choice. This was not modern medicine, but it was not ignorance either. It was a craft passed from woman to woman. The Greek physician Cyranus, writing in the 2nd century, basically created a birth manual. He told midwives to keep their hands clean, to trim their nails, to soothe the mother, and to use a birthing chair. He wanted the room warm, the oil ready, and the midwife calm. He understood that pulling too hard on the baby could make things worse. A lot of his advice would not look out of place in a modern midwifery class, minus perhaps the amulets. But ancient birth was never just physical. It was psychological and spiritual. The pain was immense. No epidural, no spinal block. And fear was not just unpleasant, it was dangerous. Modern medicine knows why. Fear triggers adrenaline, and adrenaline can suppress oxytocin, the hormone that drives contractions. A terrified woman in labor is fighting her own body. Ancient cultures didn't have the word oxytocin, but they built entire systems around keeping the laboring woman from being terrified. They did it with ritual. In Egypt, women called on goddesses like Taweret and Hathor. In Greece, Eileithyia was the goddess of labor. In Mesopotamia, amulets and incantations protected the mother from demons like Lamashtu, who was said to threaten newborns. Egyptian papyri contained spells to open the womb. Greek women might loosen their hair and unbind their belts to symbolically open the body. In some cultures, doors were unlocked and windows were opened during labor. It sounds like pure superstition, but there was a hidden logic. The sympathetic magic gave the woman a cue that this was a safe, open, normal process. Modern birth workers often do something similar: dim the lights, lower the noise, keep the woman warm. The symbols change. The nervous system doesn't. Modern research backs this up. Studies have found that continuous one-on-one support during labor can shorten labor, reduce the need for pain medication, and improve outcomes for the baby. Ancient societies didn't run controlled trials. They just noticed that a woman laboring alone in terror often did worse than a woman surrounded by calm, experienced people. So they built culture around it. Of course, no amount of ritual, skill, or gravity could fix everything. And this is where the story gets harsh. The three great killers were hemorrhage, infection, and obstructed labor. A baby that was too large or badly positioned could mean labor lasting days. With no forceps, no vacuum, and no safe surgical birth, the baby might die and the mother might follow. Postpartum hemorrhage, the uterus failing to contract after the placenta was delivered, could kill a woman in under an hour. Infection set in days later. Ancient people did not know about germs. They had no antibiotics. Some practices, like washing hands or using boiled cloths, may have helped accidentally. But when sepsis took hold, there was nothing to do. Obstructed labor was especially feared. If the baby's rotation failed, or the pelvis was too small, the baby could remain stuck for days. The pressure could crush tissues, causing fistulas, holes between the bladder and vagina or rectum, leaving a woman incontinent and, in many communities, socially ostracized. The physical pain was only part of the suffering. What could an ancient midwife do? She could try to turn the baby, massage the abdomen, change the mother's position, or manually assist the delivery. Some texts describe using oil as a lubricant. A few describe attempts at internal rotation. But if the baby was truly stuck, there was no way to safely cut the mother open. A cesarean in the ancient world was not the operation we know today. It was usually an attempt to save the baby when the mother was already dead or dying. It was not something a woman survived. If the baby died inside, the situation could become even more horrific. Ancient Indian, Greek, and Roman texts describe instruments for removing the baby in pieces to save the mother. It is one of the darkest details in the history of medicine. It also tells you something. Birth was dangerous enough that people developed specialized tools for the worst-case scenario. So, how dangerous was it? Historians estimate that in many pre-modern societies, somewhere between 1 and 2% of births ended in the mother's death. That sounds small, but women had many pregnancies. If a woman gave birth 6 or 7 times, the risk compounded. A 2% risk per birth, repeated over 6 births, becomes roughly a 1 in 9 chance of dying. Some places were worse. Some were better, but childbirth was consistently one of the leading causes of death for women of reproductive age. And yet, those numbers also mean most births ended with both mother and baby alive. If every birth had been a coin flip, there would be no human race. The system was fragile, but it worked often enough. And it worked because women were not left alone. That's the core of ancient birth. It was not a solitary biological event. It was a coordinated human activity. The midwife, the female relatives, the birthing chair, the rope, the rituals, the position changes. All of it was a form of technology, maybe the oldest technology we have. Before people wrote down laws, they knew how to help a woman in labor. The oldest medical practitioners were midwives. For most of human history, the safest thing a laboring woman could do was be surrounded by women who had done this before. Hospitals didn't invent the idea that birth needs help. They inherited it. The difference is that modern medicine added tools: forceps, anesthesia, antibiotics, safe C-sections. Those tools saved millions of lives. But the basic insight that a laboring woman needs someone with her is ancient, which means something slightly uncomfortable about the phrase natural birth. There has never been a purely natural human birth in the way people sometimes imagine. If natural means no assistance, no knowledge, no culture, a woman alone in a field, that was never the human norm. It was a death risk. The natural human birth is a social one. The thing that made our species viable was not just the pelvis or the brain, it was the helper. You are here because an unbroken chain of women, stretching back tens of thousands of years, managed to squeeze a too large skull through a too small pelvis, and almost none of them did it alone.